so much for coming back to EndoTv and talking with us today, Representative Gilchrest. You are an endo pioneer, warrior, advocate. You don't have the disease, but you know a lot of people who do, and you are fighting for the 1 in 10 that do have this illness in the United States alone. For those that are new to our ongoing discussion, please tell us what you have started and how it's going.
Great. Thank you so much for having me back. So happy to be here and to be helping in this work. So in the state of Connecticut, I formed an endometriosis working group at our Connecticut General Assembly, which is our state legislature. The group is made up of individuals living with endometriosis, some of our state agencies, health professionals, mental health professionals, and we meet monthly to discuss the disease, to discuss what's going on in the field, and to see how we can recommend policies to our legislature to make change.
And you had a hearing last week. What was that hearing about? What was that to help move forward?
Sure. So this is our second year pushing for public policy. And so last year we were effective in getting a policy passed to do a study for a biorepository here in the state. And so this year, last week, we had a public hearing where we heard a bill about the biorepository itself. And so what this would be is it would be a partnership between UConn Health and Jackson Laboratory to collect samples from individuals who have endometriosis with the hopes of being a research hub to develop treatment and early detection tools.
And in terms of testimony, you had people, varying people throughout the endometriosis community that were not only from Connecticut or living in Connecticut, but throughout the country. Who were some of those people that testified?
Sure. We had folks, experts with different endometriosis associations. We had individuals living with the disease. We had a doctor from UConn Health. We had a researcher from Jackson Laboratory. And so we had a variety of perspectives speaking to the need for greater attention on this disease and to get to patients earlier.
How does the person living in Connecticut help support what you want to do?
Great. So they could reach out to my office and get on the endometriosis working group distribution list. We meet by Zoom. You can participate. You don't have to participate, but that's a way to get information. And then they can contact their legislators. Everyone in the state has a state representative and a state senator, and let them know that you support this important legislation.
Thank you so much. And for you, what was your pull to endometriosis? I mean, we talked a little bit about it, that you know people that have the disease, but how have you really been impacted knowing how this illness can really debilitate someone's life?
So obviously it impacts 1 in 10 individuals born with a uterus, disproportionately women. And I've been an advocate for women's health and safety for pretty much my entire professional life. And I was drawn to it because once again, this is an issue where women have been ignored and they've been under-researched. And I'm just so flabbergasted that in the year 2023, we're still hearing women who have gone on for years being told that the pain they're experiencing is in their head when they have a disease that impacts 1 in 10 individuals. And so it makes me angry, it makes me determined, and I'm just committed to helping to change the field of endometriosis.
I mean, thank you for that. In terms of the lawmakers that are not necessarily as read into endometriosis, now that they're exposed to you and to how you're educating, what has been the response of those lawmakers?
I think that was, in addition to the testimony we heard from individuals living with endometriosis, one of the most moving parts for me last week at the public hearing was the responses from my colleagues, including a state senator who is new this session, who is a nurse and has been a nurse for more than 20 years, who said she had heard about it, but this public hearing opened her eyes to what endometriosis is. And so to have many of my colleagues learning along with us and coming to be dedicated to doing something to make change is just so meaningful. And so we really are creating awareness here at the legislature and beyond.
Right. And that's such a foundation because, there's not to say that anyone is dumb at all, but my father had an expression that dumb is dangerous.
Mm,
And it's almost the opposite of ignorance is bliss. I think the more people understand how a disease can be so insidious, can impact so many prongs of someone's life, physically, it isn't just bad cramps. We know that it's extra pelvic. We know that it could cause possible lung collapse. We know it could even go to the heart in rare conditions, that it could cause appendicitis, lose ovaries, leading cause of infertility, kidney failure, uterine entrapment. There's so many complications, bowel in situations where people are having parts of their bowel cut away and having to live with a colostomy bag. This is not just handling simple pain. It is not just a pain disease. Pain is an indicator of so much more. So the more people know, it's the G.I. Joe expression, knowledge is power, the more you know. And it takes people like you and your colleagues in the endo community to just be the loud voices so that we're heard in order to make that necessary change forward.
I agree, 100%.
Yeah, well, it's always a pleasure speaking with you. And I hope you'll come back and keep updating us on what's going on with the policies, because this is, like you said, this is 2023, but it's never too late to make history. And here we are.
Yes, thank you so much, and I'd be happy to come back. Thanks for all you're doing.
Thank you.